आपकी कम से कम अभी जो है क्लास में डिस्टरबेंस नहीं होनी चाहिए। आप स्टूडेंट्स को एक दूसरे को डिस्टर्ब ना करें, एक दूसरे को आप क्लास से ना निकालें, क्योंकि some student are trying to remove students if they are joining from any lobby, तो उसके साथ प्रॉब्लम होती है। मी फ्रॉम अ कैलेंडर आप जो है ऑप्शनल में ना रखें, अपने आप को ऑप्शन में रखेंगे तो मैं निकाल दूंगा, और अगर आप दूसरे के लॉबी के थ्रू अगर आप तो वो निकाल देगा। तो इसलिए व्हाट यू हैव टू डू, यू हैव टू ज्वाइन फ्रॉम माय कैलेंडर। जो मैंने कैलेंडर दिया हुआ है वहां से आप ज्वाइन करें, रादर देन तो अभी हम जो है डिस्कस करेंगे कि अल्सर्स क्या होती हैं, और इस लेक्चर को हम आगे लेके जाएंगे। तो now we are going to upload and then we are going to discuss, as we have already discussed, हमने पहले ही सिंपल स्टमक एनिमल्स के लिए डिस्कस किया हुआ है। सिंपल स्टमक डाइजेस्टिंग फूड, वो जो अपना खाना है वो हजम करते हैं बाय एंजाइमेटिक एक्टिविटी। So now we are knowing that the hydrochloric acid is one of the ingredient substance in the application को denature करता है, और फिर that is converting up especially converting the protein into a small particles, which is amino acids. And this digestion, whenever you are knowing that the acidic nature is required for the digestion of a protein, buffering system has to maintain the acidic nature of the stomach. So the hydrochloric acid is normally produced, and it helps in the digestion. Therefore, mostly this acidic nature also, whenever it is up to a 2 pH, then it is causes the injuries to the stomach. So today we are discussing the ulcers, and you can watch this again on your YouTube, and as well as you can see this presentation on team. So by definition, the ulcers are a break in the epithelial continuity. So discontinuity of the skin or a mucous membrane which occurs due to the microscopic death of the cells or tissues is known as ulcers. So the ulcers are those type of the wounds which do not heal with the normal chemotherapy. Mostly the etiology is the venous disease, arterial disease, arthritis, autoimmune disease, trauma, chronic infection like a tuberculosis or a syphilis, a neoplastic, squamous or BCC sarcoma that may have to develop the ulcers. So gastric ulcer, mostly it is well known that the abomasal ulcer or a gastric ulcer, because the simple stomach ulcer in the animal, in the simple stomach animals, the ulcer always been occur in like a gastric ulcers, and in the large animals, especially the abomasal ulcers are being observed. So the associate with the chronic renal hepatic disease or a mast cell neoplasia or a gastrin producing neoplasia. These are the tumors. Neoplasia is known as a tumor. So this tumor or a neoplasia may cause the ulcers. The gastric neoplasia are coagulation disorders. So the fibroma and the gunshot wound are the intracerebral hemorrhage that may have to lead the ulceratic wound in the stomach. The peptic ulcers may lead to the bleeding or perforation emergency situations. So the uremia, the poison, snake bite, primary ulcers are less common. Ulcers secondary common. Aspirin can experimentally to produce ulcers in the animals. So therefore, if we want to produce an ulcer in an animal as an animal model for experimentation to treat the ulcers by any medicines, homeopathic medicine or allopathic medicines, we can produce by feeding aspirin continuously to the animals, simple stomach animals that may have caused the ulcer, gastric ulcer in the animal. So abomasal ulcers like a suckling calves and the acute cattle or a buffalo can produce the abomasal ulcers. So adult first few weeks of parturition, stress and lactation can cause the ulcers, whereas the stress related like a summer months independent of a parturition may have to lead towards ulcer, abomasal ulcer. So the abomasal ulcer is very common in the cattle and the buffalo, especially in the calves, suckling calves, because the abomasum is the largest portion at the early stage of the animal. As a newborn, they have a largest portion of the compound stomach is the abomasum. So that abomasum has to lead towards the ulcer if the causative agent or a causative condition may produced. So the Wagner's grading of ulcers. So there is a grading of ulcers which is standardized by the Wagner, that if there is a pre-ulcerative lesions, healed ulcer is grade as a 0, whereas the superficial ulcer is grade as a 1, whereas the grade 2 is ulcer deeper to a subcutaneous tissue exposing a soft tissue or bone, whereas the grade 3 ulcer is an abscess formation or osteomyelitis, or a grade 4 is a gangrene of a part of the tissue or a limb or a foot, or a grade 5 the gangrene of the entire one area or a foot. This is known as the grading of the ulcers. Whenever you are doing a study, then you are grading the ulcers for a statistical package, because you need the number so that to analyze the ulcers, the depth of the ulcers, or the severity, or the damage of the ulcers being carried out in the animals. So there is a classification of ulcerative wounds. One is the clinical, or other is the pathological. So the type 1 erosion and the ulcers with a slight hemorrhage, type 2 bleeding ulcers, and type 3 is a perforation with acute circumscribed peritonitis, and type 4 is a perforation with a diffuse peritonitis. Whenever there is a gastric ulcer, that may have four types of the ulcers. One is the erosion, only the lesion is produced, which is causing a slight hemorrhage, is a type 1 ulcer, whereas there is a bleeding ulcer that may have to see that the coughing, or even in a feces you may have to find the blood, or a perforation may caused by in the stomach, which has to give a seepage or a leakage to the food into the abdomen. They may have to cause the peritonitis. So circumscribed peritonitis is the acute circumscribed peritonitis, is the initial stage of the peritonitis, whereas the type 4 perforation that may have to lead to a diffuse peritonitis. So clinical may have to spreading, age, inflamed edematous in the form, healing, age is sloping with a healthy and granulation tissue and serious discharge, whereas the callus, that's a floor, contains pale unhealthy granulation tissue with a indurated age. So this is the clinically classified ulcers. One is the spreading ulcer, which has a age and inflamed area and edematous in a form, whereas the age is a sloping with a healthy and a granulation tissue and serious discharge, whereas the callus floor contains pale unhealthy granulation tissue with indurated age. So pathological, that might be a non-specific ulcer, a specific ulcer, and a malignant. This is the three pathological types of the ulcers: non-specific, specific, and malignant. The non-specific ulcer is due to diabetes, that is known as a diabetic ulcer, tropical ulcer, idiopathic ulcer, martorell ulcers, or Benzen's ulcers. These are the 5 types of the ulcers which come down into the non-specific ulcers. So this is not especially due to any direct reason, but it is an indirect reason that the ulcer may have to produce. The traumatic ulcer, that's a mechanical cause, the dental ulcer on tongue, jagged tooth, or a physical electrical burn, or a chemical application of a caustics may cause the ulcer, which is known as a chemical ulcer. The ulcers caused by the mechanical means, caused by the physical means, or caused by the chemical means is known as a traumatic ulcer, that might be the acute, superficial, painful, and tender. The arterial ulcer that caused due to a peripheral vascular disease, the atherosclerosis or thromboangiitis obliterans, whereas the cervical rhinoids, like a chief complaint, severe pain, toes, feet, legs, and ulcerative digits. The venous ulcers may have a medial aspects of a lower third, lower limb, ankle, gastrous zone, chronic venous. Ulcers are painless, and varicose veins or post-phlebitis limbs may be seen in the ulcerative form. So trophic ulcers, that is a pressure source, or a decumbitous ulcers, punched out edge with slough on the floor. Bed sores or perforating ulcers develop as a result of a prolonged pressure, ischial tuberosity, greater trochanter, sacrum, heel, malleus, occiput. So these are the sites where the ulcers may have to develop. So the tropical ulcer, like a tropical region, Africa, India, South America, trauma and the insect bites may have to produce that tropical ulcer. Fusobacterium or a fusiformis or a Borrelia vanciti is the causative organisms which may have to cause tropical ulcers. So aberrance, redness, papules and pustules and severe pain may arise in this type of the ulcer. The diabetic ulcers, it may be caused due to a diabetic neuropathy, diabetic microangiopathy, increased glucose, increased infection, or foot, plantar, leg, back, scrotum, perineum, ischemia, septicemia, or osteomyelitis may have to cause the diabetic ulcer. So the diabetic ulcer may arise due to a diabetic neuropathy or a diabetic microangiopathy. The specific ulcers which might be due to a tuberculosis, syphilis, actinomycosis, Malignant ulcers or soft sore ulcers. The malignant ulcers like squamous cell, the basal cell, and malignant melanoma. So malignant melanoma is one of the malignant ulcer. So these are the three types of the malignant tumors which may have to lead towards ulcers. So this is a neoplasia ulcer. So this may have to arise from the neoplasia. Whereas for inspection of the ulcers, you have to make an inspection, palpation, examination of lymph nodes, vascular insufficiency, and nerve lesions. So these are the five types of the things which you have to carry out for a diagnosis of the ulcers. The inspection, in the inspection, you have to see the location, size, shape, floor, age, discharge, and surrounding area. Whereas on the palpation, you have to see the tenderness, local rise of the temperature, bleeding on touch, consistency of the ulcers, age, surrounding area, edema, mobility. So regional lymph nodes, sensation, pulsations, function of the joint, and systematic examination. Now for the inspection, you have to see the location of the ulcer, floor of the ulcer, discharge from the ulcer, age, surrounding area. Whereas the location of the ulcer may have to arterial ulcers, tips of the toe and the dorsum of the foot. So long saphenous varicosity with the ulcers, short saphenous varicosity with ulcers, perforating ulcers, non-healing ulcer. So medial side of the leg, lateral side of the leg, over the sole at pressure points or over the shin. The floor of the ulcer, this is the part of the ulcer which is exposed or seen. Red granulation tissue, necrotic tissue, slough, pale scanty granulation tissue, wash, leather salve, healing ulcers, spreading ulcer, tuberculosis ulcer, and gummatous ulcer. Whereas the discharge from the ulcers, that might be the serous discharge, purulent discharge, bloody discharge, discharge with bony spiculas, greenish discharge. The healing ulcers may have a spreading ulcers, malignant ulcers, or osteomyelitis, or a pseudomonas infection. So the serous discharge may have to be seen in the healing ulcers. Purulent discharge may be seen in the spreading ulcers. Bloody discharge may be seen in the malignant ulcers. Discharge with the bony spicules may be osteomyelitis. The greenish discharge may be seen in the pseudomonas infectious. Age, this is between the floor of the ulcer and the margin. The margin is the junction between the normal epithelium and the ulcer. These two parts present area of maximum activity, the stage of extension, stage of the transition, stage of the repair. There are three stages. So these two parts present areas of maximum activity, that is the extension, transition, and repair. So the sloughing edges, all healing ulcers like traumatic ulcers, venous ulcers having the sloughing edge, whereas the punch out age is being seen in the gummitous ulcers or atrophic ulcers, whereas the undetermined age may be seen in the tuberculosis ulcers. The raised age or beaded age, rodent ulcers or a basal cell carcinoma has produced this condition. The everted age or rolled out is seen in the squamous cell carcinoma ulcers. The surrounding area, the thick and the pigmented, thin and the thick and the pigmented is seen in the varicose ulcer, where the thin and the dark surrounding area is seen in the arterial ulcers. Red and edematous, edges are being seen in the spreading ulcers like diabetic ulcers. So on the palpation, we have to see the age, base, mobility, bleeding, surrounding area. Age induration means hardness of the age is a very characteristics of a squamous cell carcinoma. It is said to be a host defense mechanism. Tenderness of the age is characteristics of a infected ulcers and arterial ulcers. The base, it is the area on which the ulcer rests. The marked induration at the base of a diagnostic of a squamous cell carcinoma, where the induration, the maximum induration is seen in the squamous cell carcinoma, minimal induration is seen in the malignant melanoma, whereas the brainy induration seen in the abscess, cyanotic induration is seen in the chronic venous congestion as in a varicose ulcers. The age, base, and the surrounding area should be examined for induration. Mobility, the gentle attempt to move the ulcers to no fixity to the underlying tissues. So malignant ulcers are usually fixed, benign ulcers are not. The bleeding, malignant ulcers is friable like a cauliflower. On gentle palpation, it bleeds. Granulation tissue, as in healing ulcers, also causes bleeding. Surrounding area, the thickness and induration is found in the squamous cell carcinoma. Tenderness and pitting on pressure indicates spread inflammation surrounding the ulcer. The abomasal ulcers, primary abomasal hyperacidity in the fasting animals, mechanical aberrations, bacterial or Clostridium type A and C, fungi like Aspergillus and Mucor species, stress with the inflammatory process. So these are the primary cause of the abomasal ulcers, whereas the secondary cause of the abomasal ulcer is due to any other disease like lymphoma, LDA, RDA, and BVD. LDA is the left displacement abomasal, right displacement abomasal, bovine viral diarrhea. The type 1, the non-perforating, type 2 ulcers with a severe blood loss, type 3 is a perforating ulcers with local peritonitis, type 4 is a perforating ulcer with diffuse peritonitis. So the diagnosis is temperature, respiration, pulse, pain on the left of a xiphoid abomasal ulcers, pain on right side due to abomasal ulcers. So diagnosis, the clinical signs, melena, plasma gastrin concentration level increased up to 100 pg per ml, where the serum pepsinogen concentration is increased 5.5 microliters per liter, is indicative of abomasal ulcers, not in a sheep. Whereas the CBC hemogram can indicate the ulcerative condition in the animals. The double contrast radiograph may have to create the pneumoperitoneum and give a barium meal, the barium ulcer appears as an outpouching from lumen containing a contrast material. So in the ulcerative conditions, peptic ulcers or even gastric ulcers, you have to go for radiography, and that will lead to a diagnosis of the ulcers. So endoscopy can be performed to see that not threatened bleeding causes allows the biopsies. Exploratory laparotomy if a life-threatening hemorrhage is there. You can perform an endoscopy by which you can diagnose the ulcers in the stomach, and as well you can perform exploratory laparotomy so that you can stop the bleeding and also remove the portion or a part of ulcer from the stomach and then rejoin the normal or healthy edges to each other. Dark terry color, dunk, abomasal ulcers. This is the sign of a ulcer that the feces or the dung will be bloody, and that will be a dark terry in color. So this indicates that the animal is suffering from an abomasal ulcer. The regional lymph nodes, the tender and enlarged, acute secondary infection, non-tender and enlarged chronic infection, non-tender and hard squamous cell carcinoma, non-tender large firm and multiple malignant melanoma. So these are the regional lymph nodes which can be palpated and seen if they are tender and enlarged, that may have to lead towards acute secondary infection, whereas the non-tender and enlarged is chronic infection. Non-tender and hard may be seen in the squamous cell carcinoma. Non-tender and large firm multiple can be seen in the malignant melanoma. The investigation can be performed by the complete blood picture, hemoglobin, the differential leukocyte count, and then the erythrocyte sedimentation rate can be seen. The urine and the blood examination to rule out the diabetes, the chest X-ray to rule out the tuberculosis, the pus for culture or sensitivity, lower limb angiography is in cases of arterial diseases, X-ray of the part to see for osteomyelitis or a biopsy, non-healing or malignant tumors can be diagnosed by the biopsy. The treatment, the blood transfusion in anemic conditions, antacids are ranitidines 10 to 50 mg per kg, choline, pectin, aloe vera orally. The treatment, address the cause, correct the deficiencies, control the pain, infection, debridement, dressing, closure of the defect. The treatment of the ulcers, treatment of spreading ulcers, treatment of healing ulcers, and treatment of chronic ulcers, and treatment of underlying disease. So we have to give a treatment all these types of the ulcers differently. So the treatment of the spreading ulcer is to take a pus culture and report for a sensitivity, appropriate antibiotics on the sensitivity test which is reported that may be prescribed, solution to treat the sulf by hydrogen peroxide and yosol. So Edinburgh University solution, a hypochlorite solution can be used, excessive granulation tissue, proud flesh, action or application of a copper sulfate or a silver nitrate can be done. Repeated dressing is required for ulcers. The treatment of a healing ulcers, the regular dressing are done for a few days, and antiseptic creams like liquid iodine, zinc oxide or a silver sulfonide, sulfadiazine can be used. Culture swab is taken to rule out the Streptococcus hemolyticus, contraindications for skin grafting. Ulcer is small, heals by itself, epithelialization, large, free splits, skin graft applied. Whereas the treatment of a chronic ulcers, these do not respond to a conventional methods of a treatment. The following are tried: infrared radiation, shortwave therapy, ultraviolet rays decrease the size of a ulcer, whereas the aminoin helps in epithelialization, choroin helps in granulation tissue. These ulcers ultimately may require skin grafting. The treatment of the ulcers, especially if there is the ulcers which does not heal on the conventional method, then requires a surgical excision. Cranial midline incision can be performed to carefully palpate from the fundus to a pylorus. If the ulcers then adhesion, serosal scarring, irregular thickness, areas on a gastric wall can be seen, and then inspect the pancreas, gastrinoma, P nodules, or if the gastrinoma in block resection of a lobe or complete pancreas 90% removal, no endocrinal insufficiency may be carried out. Whereas the small ulcers, that epithelial incision, mucosa, closed, simple continuous 3-0 or 4-0 absorbable chromic catgut are interrupted Lambert on a serosa and muscularis. A Vicryl or a PDS can be used for closure of the small intestine, especially the stomach in the dogs. The chromic catgut is contraindicated or not indicated for the use of a closure of the stomach because they are carnivorous, and the chromic catgut is made up of the intestine of the sheep, submucosa of the intestine of the sheep. Therefore, if it is being used in the stomach, it will be digested and the sutures will be open. So therefore, the chemical nature suture materials should be used, like a Vicryl, like a Dexon, like a PDS. So multiple ulcers on a pyloric part, Bill-Roth 1 gastrotomy technique is used for the ulcer of the Bill-Roth 1. So pyloric ulcers, if there is a multiple pyloric ulcers, that can be treated with a gastrectomy technique, means removal of the portion of the or a part of the stomach. So gastric acute dilation and torsion, gastric dilation, volvulus are only a dilation common in puppies, overeating, parasitism, large and giant breeds or deep-chested breeds may have the ulcers. So overeating relieved by induced vomiting and passing stomach tube, parasitism, pica, or postprandial activity, delayed gastric emptying, pyloromiotomy. This may have to cause the ulcers in the dog. So these are the causative reasons which may have to lead towards gastric ulcers, and that may be treated by gastrectomy. So the pathophysiology is the rotation after dilation, aerophagia, source of intragastric gases, distended stomach, gas plus fluid, more prone to a rotation, prevent the eructation, esophagus and emptying from the duodenum, distension increases in the dog. So the presses the caudal vena, portal vena, reduce the venous return, and the carbon reduce the cardiac output, reduce the tissue perfusion and shock ischemic bowel, release the toxins, endotoxemia, shock and hypotension, reduce the ventilation and pressure on the diaphragm. So thank you very much. This is the one of the lecture where we have to end up, and you can watch again this lecture on your YouTube and as well as on the team. So now I'm going to open your mics to talk and ask any question related to this lecture. So you are now open. जी बेटे
सर ये दोनों में होता है ना, ह्यूमन में भी होता है और एनिमल्स में भी होता है अल्सर?
जी जी, दोनों